So why don't we just get started by saying that I couldn't think of a better way to spark the interest in the Asian talent pool by pointing to one of the brightest lights that make us all very proud to be Asian New Zealanders, Dr. Swee Tan. Dr. Swee has recently won a fabulous award. I'm pleased to say that New Zealand Asian Leaders nominated him. It's time for us to recognise that we have top Asian talent in New Zealand. And we're not just good at working hard. We're not just good technically. But we are leadership material, and we can be strategic, and we can be amongst the world's best in terms of what we do. And Dr. Swee Tan is certainly amongst the world's best. Swee is going to talk about a new way of looking at cancer, but if you want to know his background, he was originally from Malaysia. He's an internationally recognised surgeon and research scientist. He's been dubbed by the Dominion Post as a modern miracle worker. His research into the origin of strawberry birthmarks and their treatment has some exciting implications for the treatment of cancer and representative medicine. He just has done so many things. He's actually founded and he's the director of the Centre for the Study and Treatment of Vascular Birthmarks and National Referral Centre. He's had many, many honours. Why do I want Swee to talk to you? Well, because Swee came to New Zealand and this is his adopted country. And he could be doing this research anywhere. In fact, he'd get a lot more money, I'm sure, if he did it elsewhere. But he chooses to remain in the Hutt Valley in Wellington. That in itself is interesting. And Swee, we salute you, and we're really looking forward to what you have to say. Lift our sides, really, about what Asian New Zealanders can contribute to this country. Thank you.
I'm the Executive Director of the Gillies McIndoe Institute, housed in this building in Newtown, Wellington. I was trained as a plastic surgeon, and plastic surgery allows me to help someone like David, born with a paralyzed face, someone with injury, and someone with cancer. Most of my work as a plastic surgeon is about cancer, particularly cancer in the head and neck area. This is a picture of a tongue cancer, the most deadly form and most common form of oral cavity cancer. The treatment today is surgery, which involves taking half the tongue away, all the lymph glands on that side of the neck away, and then transferring tissue from the forearm to the mouth and then connect the blood vessels to give it a new blood supply and a tracheostomy. This operation will take 1 day, and the patient will be in hospital for about 10 to 14 days. And then radiotherapy will come in, and it will go on for 6 weeks, sometimes chemotherapy and sometimes biologic agents. Now for 40 years, 1 out of 2 of these patients will die despite that very awful treatment. Cancer is a huge problem and is an increasing problem for the world. 1 out of us will develop cancer in our lifetime. In 1970, President Nixon declared war on cancer. We will cure cancer, like Kennedy said. We will go to the moon. Since then, over $1 trillion has been spent on cancer research. Now, we have some modest improvement in cancer treatment for all the cancer types, except some childhood leukemia, breast cancer, and brain tumor. Now, we have, over the last 10, 15 years, come up with some partially effective but very expensive drugs for cancer. So the story about cancer research and cancer treatment has been a story of incremental improvements. This research is based on this prevailing concept that has been around for 100 years. It says that a cancer starts from a mature normal cells that undergo mutation or mutations from a cancer cell that multiplies a cell that we cannot control. This prevailing concept underscores our research and our treatment for cancer and the search for the silver bullet having on ever since. My other interest is vascular birthmarks. So these are a lifelong problem for which we don't have good treatments for. The most common type of vascular birthmark is strawberry birthmark, which is a tumor which grows out of nothing to a big tumor and then it destroys itself, usually leaving a fatty lump. It is disfiguring, but it can cause all sorts of functional problem or life itself. When I returned from overseas as a plastic surgeon, there was no satisfactory treatment for this condition. The conventional treatment approach was that in a situation like this, birthmark threatening the vision, you give the child high-dose steroid to stop the growth, and then over a number of years doing surgery and laser treatment, and you end up having an outcome like that, which superficially looks wonderful, but really when you think about it, it is pretty awful treatment. One of my first patients was Laura, who was 6 years of age, with this fatty lump on her cheek and the upper lip as a result of a large birthmark treated in the conventional way. This was the end outcome of the surgery I did for her, and Laura and her family were delighted. But I was profoundly unhappy because her mother showed me these other photographs. And I thought we should have a treatment between those photographs, preferably between the first two. But we did not know how, because we did not know why this occurs. This compelled me to retrain as a research scientist, believing that through research we can figure out what causes this and therefore a better treatment for strawberry birthmark. But I also believe that if we can better understand the nature and the cause of strawberry birthmark, we may be one day closer to finding a cure for cancer. There were many obstacles. Not having a track record was one. But the biggest hurdle was concept. Because when we started looking here, the prevailing concept was that this is a problem of blood vessel cells. Now this was a child that was referred to me with a pretty awful strawberry birthmark. She also happened to have a cleft of the sternum. Now some of these children would have heart problem, eye problem, brain problem, and sometimes absent carotid artery. All those structures are formed during the first 3 months of life. And if you look at the pattern of the strawberry birthmark, it is reminiscent of those facial processes that occur in the first 6 weeks of life. When we're being formed, cells from behind our head migrate long distances to form processes of the face, which then fuse together to form a complete face. This led us to come up with this alternative concept of strawberry birthmark. We said strawberry birthmark is a problem with stem cells, and if that was the case, these cells should be regulated by primitive systems. Through the research in the last 18 years, we now know strawberry birthmark is a problem of stem cells, and we have a lot of evidence that these stem cells come from the placenta. If you take a piece of strawberry birthmark from a child, you can grow it in a lab, and within a week you can see these stem cells growing out of it. These stem cells can be made into fat cells, bone cells, and in fact red blood cells. So what regulates these primordial cells? We are talking about cells that you expect to find soon after conception. We discovered this hormone system, 3 steps, and with 2 catalysts. Very simple system that regulates the stem cells. These discoveries underscore the new and more effective treatment of strawberry birthmark. I'm going to show you an example. You can block this system by blocking one of the catalysts with beta blocker, which is the medication we take for high blood pressure. This is a child with a large birthmark on the cheek and the eye socket. You can see the eyes pushed upwards. And that was her after 1 week of treatment with medication taken by mouth twice a day at home. See the eyes now at the same level. A month later, 5 months later, age 3. Now, we predicted that we can equally block the other enzyme, ACE, with another medication that we use for treating high blood pressure, and we conduct the world's first ever successful clinical trial using this approach to treat a tumor. There was Zoe, 5 months old, with a large birthmark on her face. That was her 4 months later. And I was very pleased. Mom brought her to see me just before she went to school. Nothing on the face. Now, last year we were invited by Professor from Mayo Clinic to contribute a chapter to this 2-volume book on ACE inhibitors. And that was the chapter we put in. And when the book was published, we were sent a copy. And we were very touched by what he had to say. He said, Tan, that's me, and my colleagues in Wellington, New Zealand, has done this. And then he went on to say, drug manufacturers and cancer research must take note of this major paradigm shift. Now, we have been looking at cancer from a completely different concept, cancer stem cell concept. Within a cancer, you've got 2 types of cells. You've got the cancer stem cells and cancer cells. The latter form the bulk of the tumor. If you just imagine cancer is like a beehive, you've got a queen bee. This queen bee is able to make copies of itself and then move away and set up new hives, so the cancer is spread that way. It also makes the worker bees, which are the cancer cells, lots of them. But the cancer cells, they have limited lifespan. They'll die themselves if you do nothing. So we have applied this concept to the investigation of cancer, and we started with tongue cancer. We have demonstrated the presence of cancer stem cells in tongue cancer. You can see the nuclei are in blue. The green is the cancer stem cell marker on the membrane of the cell, and the red is the embryonic stem cell marker. You do not expect to find that in an adult. Now, we then went on to look for the regulatory system that controls the cancer stem cell population. And this is just one example, malignant melanoma. We have found the regulatory system that controls the cancer stem cells. Just imagine one day we did this to cancer. Cancer treatment is awful. I'm sure you would have known some people who underwent cancer treatment. If I have cancer, I would like to be able to take some medications and carry on working, come to a meeting like this, talking to people, not stuck in the hospital, losing my dignity and my quality of life. This is our website if you're interested, and if you would like us to keep you informed, drop us a note and we can get you an answer.